Greetings, this is the coronavirus COVID-19 update for 3/7/2020. And as usual, we'll start with Baidu, the Chinese search engine that set up a page to track coronavirus numbers and stories. So the first thing we want to look at here is a cumulative diagnosis, 80,859. Up only 46 from yesterday. That's a really small number because China has things under control, basically. Suspected new cases up 84 to 458. Cumulative cure, which most countries call a recovery, not a cure. China did not cure 57,000 people. Of the 57,143, probably 56,000 recovered on their own with very mild symptoms. Existing severe cases, 5,264. These are ICU cases, intensive care people with either a bad case of pneumonia or organ failures of some sort. And deaths are at 3,100 now in China. And the map, which usually doesn't change too much, is changing a little bit now. You see some areas of the country that are getting lighter in color, which they don't really have anything new on the legend here, but the changes in color are probably related to the number of cumulative cases minus the number of cured, they call, or recovered cases. Then if you go down further on the same page, you'll see two graphs. This is the first one. So we're showing number of new deaths, 27, and the number of deaths is kind of trending down if you look at the black line. The red line really trending down, which is new diagnosis. That's been going down for a month now. And added suspected cases also going down, and recovered cases generally going up. And this is the second map that they have, or a graph that they have, and it looks like there's no data in for 3/7. But on a national level, the number of new cases, they have the number of new cases in all of China being the red line, and then the pink line is the number of new cases in Hubei province, and the gold line is the number of new cases outside of Hubei. So they're all three generally trending down. Then if you scroll down further, you'll see a list of provinces here. And in Hubei province, we have 41 new diagnoses, which probably is all in Wuhan, although the number's not in there. And then if you scroll down further, you see the hot search topics of the day. I usually cover some of these stories. Today I'll take a look at 7 of them because they're all, relatively important to mention. So on the upper left, what do we have here? Hubei. This is Hubei province. And they are issuing out, green code, in other words, some kind of green paper that says that you are allowed to travel within the province and maybe go back to work. So, the first batch of people were given these green passes. Then on the upper right, bad news here. This is a COVID-19 quarantine hotel that collapsed. So that could be because the hotel was way overbooked, or too many people to a room or something. We don't know why the hotel collapsed, but a hotel collapsed. And it's not all that unusual in China for a building to collapse. Just wasn't made to handle whatever situation made it collapse. And then the third story is Iran had a person. We knew this person was positive for coronavirus a few days ago, and she has died. I think this is Iran's highest woman in politics in Iran. Then next, what do we have? Shandong cracked a case of oversized, fake, and shoddy masks. So some company was just manufacturing masks and they weren't tested and they weren't adequate. And they arrested several people, and it would be bad to be those people right now. Up on the right, a 100-year-old patient recovered. I don't know what the significance is of this smartphone, but it could be, that person talking to someone. But anyways, a 100-year-old patient that recovered, that's pretty spectacular news. Most old people don't recover. There's like a 50% fatality rate, and this person is extra old and recovered, so you gotta like that. And then there's news of the new Grand Princess. That's the way it's translated into Chinese anyway. 11 Chinese citizens are on board this cruise ship that is stranded somewhere outside of the San Francisco Bay Bridge right now. And then the last story we had was a tribute to the frontline nurses, and the story on the left came from CCTV, which is Chinese biggest television network. And this photo on the upper right is just some people that they want to pay tribute to, nurses on the front line, in other words. And the one on the lower right I had to dig up because I saw it a couple days ago, and I just wanted to put it on this tribute page. But this is a picture of a couple of Chinese nurses on the front line, and their faces are just really bad. Why? Because they work like 12-hour shifts. They're not allowed to take any breaks at all, not allowed to have lunch or anything. The person on the left looks like her mask was causing some kind of cut in her face, and she put a bandage on it so she could put the mask back on. And yeah, they wear their masks tight because, it was reported a couple of weeks ago that 1,700 frontline healthcare people died, and now that number I saw, up to 3,000. So if you want to stay alive, you should wear your mask pretty tight, and hopefully they change them every day. But anyways, this is just a tribute page to the frontline medical workers, female, because it's Women's Day. Then the next thing we look at every day is this Johns Hopkins. This is a global tracker. Everything you saw previous to this was China only. So now we have a global tracker, and our number for today is 105,837 with 3,559 deaths. The thing I do is compare that with China's number. So you can see China has confirmed cases at 80,859. We show them at 80,652. So we're behind a couple hundred here. That would still give us it'd put us over 106,000. So then we take a look at the hotspots. So South Korea, Italy, and Iran have been hotspots for a while now. And you can see South Korea went from 6,600 cases to 7,000. Iran went from 4,700 to 5,800, and Italy went from 4,600 to 5,800. So some big increases there, especially Italy and Iran. And if you look on the right, these countries are, getting up there on the death chart too. So Italy with 233 deaths, Iran 145, and South Korea with 44 so far. And outside of Hubei province in China, these are the biggest numbers in the world. You can see the number underneath that is Henan province, 22 deaths. So Henan is China's number 2 populated province, just behind Guangdong province down south, with Guangzhou and Shenzhen, two really big mega cities. And Henan is just west of Hubei province. So that's a big number for China outside of Hubei province. And we have 3 hotspots now in the world that have surpassed every other province in China. That's not good. So we'll take a look at these for South Korea. And 2 apartment buildings in South Korea are quarantined. These are apartment buildings where mostly people from this church who has been at the epicenter of this outbreak in South Korea. half of the tenants from this apartment building are members of this South Korean church. And on the upper right, South Korea's coronavirus climb above 7,000, most cases traced to the church. And on the lower right, I saw this thing from the United States forces in Korea. They're tracking they have their own little tracking device for South Korea. And let's see, what do we have on the lower left? South Korea grapples with mask shortage. So a lot of countries in the world are facing a mask shortage now. Try to buy one in the United States and you'll see what I mean. Then next we have Italy. Italy set to quarantine the whole Lombardy province. So that's big news. And I try to get cases out from the source. Like you can see on the lower left, La Repubblica. So I didn't say that very Italian sounding, did I? So this talks about a decree. Actually, if you want, there's just something lost in translation here, or they just don't do a very good job of covering it. Actually, the Irish Times, has the best information here. But Italy is set down to lock down an entire province. And, that's going to go into effect pretty soon. And I think it'll go into effect on Monday. Oh, due to come to force on Sunday, it says in the Irish Times, bottom line. So this is drafted up now, and some people call it a rough draft, and some people say it's not a rough draft. This is what's going to happen. But it looks like almost all of Lombardy province, or the whole province, is going to be locked down. And upper right, Italy, coronavirus death toll tops 230, cases near 6,000. You can see they're at 5,800 now. Then we have Iran. So death toll rise to 145 in Iran. And we already saw this. Iranian MP dies from COVID-19. That was covered in the Chinese news. And on the bottom right, China has chartered a flight to evacuate Chinese citizens from Iran amid the COVID-19 outbreak. And you can see this is a video. There's these people in the hazmat suits are flight attendants, and the rest of the people are just wearing masks. And everybody's waving a Chinese flag. Hey, we get to go home. We came to Iran to infect people, and now we're going home, leaving Iran in pretty bad shape. And just another mention of this news came out yesterday. I just decided to put it on here again today because it's ridiculous. Iran commander blames USA for COVID-19. Yeah, this is a pipe dream, that Iran could blame the United States on some kind of biological attack because, Americans hate Iranians. But that's not true. Americans hate the same people the Iranians hate, and that's the leadership in Iran. Simple as that. You can tell by, being up to news on college students in Iran, see who they hate. It's not Americans. It's their own leaders. Then what do we have? We have a mishmash of things happening here. France went from 653 cases to 949. Germany, 670 to 799. Those are pretty good-sized jumps there. Japan, 420 to 461. Spain, 400 to 500. And the US of A, 275 to 416. So I'm just going to, sometimes it's just not worth the time to try to look for articles for each one of these. It's easier to find them for the hotspots, and more important too. So what do we see here from France? Death toll in France mounts to 16 with 949 confirmed cases. It doesn't give you much detail on it. There's another picture of the Chinese hotel that collapsed. And on the New Straits Times, this has nothing to do with France. This is a publication out of the straits down by Vietnam and Southeast Asian countries. But they say COVID-19 cases, or COVID-19 soars to 613. So this is older news. And let's see what else they say. Paris, 613 confirmed cases of COVID-19. That's a lot for one city. Now where are we at? Germany. Germany, it's for some reason it's really hard to get news on Germany from German sites. So, I do speak German. I went up to the German sites for, Der Welt, the world, and Spiegel, which is the Mirror, the two biggest publications in Germany. And, they have news about the rest of the world, but nothing about Germany. Everything's okay in Germany, even though they went from 670 to 799 cases. So they just basically have news about Italy. Let's see, Shanghai, and what's the one on the right? This is about an ice hockey game, World Championships in Canada. No news about Germany. No explanation for the big increase in cases. No stories at all relating to anything going on in Germany. Just the rest of the world. It's almost a waste to look for German news every day. You have to. I thought it would be better. I went to the actual German language sites of these two publications and, translated into English. And, no news about what's going on in Germany. Then what do we have? Spain. Spain goes from 400 to 500. Spanish town faces police lockdown to contain coronavirus. So this is lockdown entire blocks of a neighborhood in Haro, a small town in northern Spain. So Spain still blames their initial coronavirus cases on people returning from Italy. And in Japan times, there's Japan's COVID-19 infections much higher than reported. This is from a health official in Japan who feels that the numbers could be several times. I think that's it. Yeah, likely several times higher than government reports. So that's not good, and that's coming from a professional in the healthcare. And on the bottom right, Osaka. I've been to Osaka. Mass COVID-19 infection suspected at 2 Osaka music venues. So I don't know, maybe Japan's numbers aren't right. They have the Olympics to worry about this year, but they also have the approval, the okay from the International Olympic Committee to delay the games to later in the year. But, that would cause problems for a lot of people. So we don't really know what's going on in Japan, but if they had any incentive to state the numbers lower than what they actually are, it's probably due to the Olympics. Then what do we have? We have the USA. So as you can see, the USA went from 275 to 416, another massive increase for the US. There's just a lot of hotspots in the US that are out of control. And total confirmed cases, 428, 17 deaths now, and 8 people recovered. Now, this recovery number is really, really low. Even if you consider like a week ago when the United States was sitting at, 14 cases for about a week, and then 15, the 15th case got picked up in Texas, and then number 16 back to California, and then we repatriated a lot of people from the cruise ship, and there was a big jump up to 60, and since then there's been big jumps every day in all of these hotspots. So we have hotspots in Seattle, which includes King County and another county up there, both accounting for a lot of cases. San Francisco Bay Area, Los Angeles area, and New York. And then, Toronto's pretty close to us too, and that's a big hotspot for Canada. So news, this is from yesterday because I wanted to make a point again. Washington State urges patience as COVID-19 test delays stoke anger. Anger, what kind of anger? Who's angry? Doctors are angry. That's who's angry because they don't have any test kits and because the CDC is an incompetent bunch of idiots. I'm going to have another video on what happened with the CDC. I could go in there and replace the whole group of people and we'd be in better shape tomorrow. These people are just total idiots. That they have some responsibility. They're not doing anything. They're not even doing the basic thing of providing test kits. That's step one. So anyways, COVID-19 has been circulated unchecked for weeks. These are both stories that were in yesterday's video, and I went over that in a little bit of detail. I just wanted to show you again, a lot of people in a lot of hotspots in the United States, medical people, they're really getting mad. Then what do we have? News, coronavirus in the U.S. More than half of all states are reported to have COVID-19. On the left, the death toll reached 17 when Florida health officials reported 2 fatalities. And Seattle area hospital caring for, most of the coronavirus patients have, people have died, reporting 3 more deaths there. And on the lower right, this is a map of the states that are, that have cases of coronavirus now. And you can watch this video and the states just light up. You can tell it's going to go nationwide. Every state is going to be affected pretty soon. Ohio is probably the most populated state that hasn't been affected yet. That will probably change very soon. Then what do we have? We have news about this cruise ship. So this is really interesting. We have a cruise ship where, the news a couple days ago, this is a cruise ship, by the way, that's the Grand Princess. And this ship is located somewhere outside of the Golden Gate, just, out in the ocean right now. It doesn't have a place to dock, although it should have a place to dock in the next day or two in some military port probably. But it's, the passenger's still in limbo here. Now in the middle one, this is really shocking that there's 21 people infected on this ship and 19 are crew members. So what comes to mind first is, the CDC again. There were no recommendations about cruise ships because these people sit around and smoke crack all day. They don't have any recommendations for anything. It's their responsibility. Center for Disease Control. They should be issuing recommendations to people, like recommendations about cruise ships. So 19 crew members, you have to wonder, 62 people on this ship were out on this ship in the last cruise. Their cruise got cut short, so they were gifted a new cruise, and 62 people went back out right away. Well, maybe we don't understand the incubation period as much as we thought we did. Maybe some of the tests, or we don't have any test kits. So how did we test these people for coronavirus? So 21 people and 19 crew members. So the crew members they're like facing, okay, I feel a little sick, but I'm not going to say I'm sick because I need money. I need to get paid. This is my living. So, there's no regulations with cruise ships, and cruise ships are virus incubators. You have to be very careful with them and define a set of criteria for cruise ships to follow. This would not have been a good idea. For anybody that's spent any time in the consulting business like me, it's just not a good idea. And on the bottom right, Irish citizens, Santa Cruz reports first case, Modesto, California couple. Yeah, there's all kinds of people on this cruise ship that are going to come down with coronavirus now because 21 is where they're starting right now. So this is craziness. Somebody should be setting definitions here. And what else do we have? University of Washington, the first university in the United States to shut down classrooms. They're going to, be virtual for the immediate future. And then we have this, Life Care Center, Kirkland. This is where a lot of people have died, and this is a coronavirus, recovery or isolation area. And, these people just arrived there too late, and they weren't tested early enough. And, unfortunately, coronavirus, the virus, ran rampant in their bodies. And, we've got some old people here who are in really bad shape. And that's not all the deaths that you'll hear from, with this care center in Washington, in the Seattle area. Then what do we have going on here? I just put in some random things from other states. A lot of people on the upper right, there's some people that got together and, they're concerned that our Native Americans are going to be left out on this, where we don't have any test kits for them. I mean, I don't think there's any coronavirus yet, but there's a bunch of senators saying, hey, don't forget our Native American people. And Pennsylvania, 2 presumptive positive cases. Connecticut saying, they're pleading for more tests. They don't have enough test kits. In Ohio, which doesn't have a coronavirus case yet, and they have some test kits, so they're ready to test. 5 people were tested, and the results are still pending. Why? Because they have to send the kits back to the CDC. Insane policies and procedures here from the CDC. Okay, elsewhere in the world, we have some news out of, I looked up the pronunciation of this and got 2 different versions. It's either Gauteng or Gauteng, and you don't say the G. Anyways, this is a province in the Republic of South Africa, and that's where Pretoria is located, the city. So, in Johannesburg. So if there's any place in Africa where a coronavirus outbreak wouldn't be that bad, it's probably in the Republic of South Africa. Not that you want an outbreak anywhere, but the rest of the African continent, we've seen what Ebola did to a lot of African countries. So the medical facilities in the Republic of South Africa are pretty good. And the same with Namibia to the west. I'm a little familiar with that. It's mostly in Windhoek, the capital. It's a strong German settlement. There's a lot of German people that retire there. Pretty nice weather. And big, huge German population and pretty good medical facilities. And most of the country, of course, you get outside of the capital, Windhoek, and you're out in the country, you're out in Africa, you're out in the plains. So, you don't want to see an outbreak in any rural areas in Africa, and only a couple of cities are outfitted to handle an outbreak like this. So Bangkok Post, 2 Thais back from Italy have COVID-19. People who travel get coronavirus, especially if you travel to a hotspot. And lastly, I used to put this graph on here all the time because I used to look at it and see what the day-to-day or week trends are, but you can't tell anything because the graph is not right. That's all we have.